Oops. Sorry. I was trying not to need to do a part 4, but I kind of ran out of time on part 3. I mentioned that I did a lot more damage during the fundraising activities back in 2010, and that I've been pretty much bedridden since then. I did mention that the Cymbalta is helping, as are the methods that I'm learning from those books on dealing with my pain, and I'm starting to be able to get up and do things, as long as I'm very careful and pace myself. So, for example, cleaning, I used to do it in 15-minute bursts. Clean for 15 minutes, sit down for 15 minutes, repeat. Well, now it's clean for 5 minutes, sit down for 15. Things take a lot longer, but at least I can do them, which I couldn't do 6 months ago. Anyway, I wanted to give you my diagnosis, or multiple diagnoses, from the CAT scan. It took me 9 months to get my doctor to write the CAT scan. I kept telling him every month, because I was seeing them every month. Now it's every 3. I mentioned all the new symptoms. I mentioned all of it, and all I wanted was a CAT scan. But he just kept saying things like, I won't change your medication. And even though I would tell him clearly, I'm not asking you to change my medication. I do not want more medication. I want a CAT scan so I can see what's going on. You know, if I've done new damage, because some of these symptoms were all new. I hadn't had them before, like the severe pain on the right SI joint. It used to ache once in a while when it rained or when I did too much, but this was a very sharp pain. I mean, it literally feels like somebody is stabbing the top of my SI joint with a butcher knife. It's just not good. Well, finally, he ordered the CAT scan in January. In order to finally get him to do that, I had to bring my husband with me to a doctor's appointment so that he could tell the doctor the same thing I'd been telling him for months. And he finally listened to my husband. Thanks to the DEA and a lot of political crap that's going on in the state of Florida, all chronic pain patients are now being assumed to be addicts until they prove otherwise. The fact that I've been with the same doctor's office for just under 10 years, and I've never failed the urine test, I've never called for early refills, I've never lost my meds, I've never lost my prescriptions, I never broke any of the rules. I'm still assumed to be an addict, which just pisses me off, but that's a whole nother topic. Anyway, the CAT scan results showed that L4-5 remains a degenerated disc. L5-S1 went from herniated to desiccated disc. A desiccated disc is a more advanced stage of degenerative disc disease. Basically, it means it's shredding. More scar tissue has shown up at the sciatic nerve roots at L4-5 and L5-S1. I've herniated L3-4. I'm growing some kind of a tumor or a growth. It's called an intraosseous hemangioma, and that's on my L1 vertebrae. I need to get that checked out because also in 2010, I had a cancerous tumor removed from my right breast, and my biological family has a very high incidence of breast cancer. My mother's mother died at the age of 31. My biological mother died at 45, I believe. Every female on both my biological mother and biological father's families all died of breast cancer. None of them lived past the age of 50. So I have a high chance. The particular tumor I grew is a rare tumor. It's called a Phyllodes tumor. It's not the standard ductal cancer for breast. Instead, it's connective tissue. It does not pass through the lymphatic system. It passes right through the bloodstream. The tumors themselves are made up of capillaries and endothelial cells. Those are the cells that line your blood vessels and your veins, etc. An intraosseous hemangioma is made of capillaries and endothelial cells. Now, Phyllodes tumors, when they do recur in one of two places, the lungs or the spine. It's probably not a Phyllodes tumor because those are extremely aggressive. The one I had done a breast exam and everything was normal. 2 weeks later, I did my next breast exam and I had a tumor that was a little over a half an inch. And by the time they took it out, like 3 weeks later, it was over 3/4 of an inch. That's how quickly they grow. They do not respond to chemo. They do not respond to radiation. The only treatment is to cut them out and get as wide of a clear margin as possible. So that's my spine. Now, as far as my pelvis goes, I have a lot more arthritis in the right SI joint. The right SI joint is separated more than it used to be. Those extra bones growing off my L5, or that had grown off my L5 vertebrae, what they call near sacralization of the lower lumbar fifth vertebrae, also have a lot more arthritis where they're rubbing up against my ilium. On the left SI joint, there's more bone fragments. There's another fracture line. The plate and the screws are all loose, which is allowing the bones to rub together again. And you can actually hear it. It pops and snaps and cracks, and so I make a joke. When it starts doing that, I'll say something like, "Snap, crackle, pop, Rice Missy," because it sounds like a bowl of Rice Krispies. You gotta find, humor somewhere or you're gonna go crazy. So yeah, I tend to crack jokes about things about my condition and stuff because it keeps me sane. More arthritis has set into the left SI joint as well. But I've also grown a type of bone that's called an ankylosis. There's a disease called ankylosis spondylitis, and that is where every joint in your body self-fuses. You grow a bone, but it's not a normal bone. It's similar to rheumatoid arthritis, that the damage, the damage that rheumatoid arthritis does to your joints. It's similar to that in that it's caused by your immune system attacking a part of your body. Recent studies have, shown that people with a permanent injury that the body has tried and tried and tried to heal and just can't, that eventually the body switches from trying to heal it to trying to kill it. Apparently it assumes that since it can't heal it, then it must be a foreign object or an infection of some sort, and the immune system will attack it. My immune system is now attacking the permanent compound fracture of the left SI joint. In an attempt to do that, it grew this ankylosis bone that is similar to rheumatoid arthritis. So that's where I stand right now, well, or sit, as far as my diagnoses. All of the above causes pain, every single bit of it. So I have a lot of pain throughout the lower back and the pelvis, and with the nerve damage comes the sciatica, the occasional loss of bladder control, though that has not happened in a while. I don't push myself far enough for that to happen. What was I just lost my train of thought. I know fibromyalgia patients and ME patients talk about having brain fog, or brain fog, not frog. I was reading a blog written by another chronic pain sufferer, and she used a phrase called pain brain. Apparently they're finding that people who live in constant pain have memory issues, etc., and their thoughts are all fuzzy, similar to the brain fog of fibromyalgia. So yeah, I still have that. My short-term memory is not as good as it used to be. I have a really hard time remembering names and things like that. But that's pretty much where I stand right now. I'm trying really hard to get more mobility back and to try to lose some of the weight, though I think that's caused more by a thyroid issue than just the fact that I'm not very mobile at all. But that's where I stand right now. Oh, and major depression is the other diagnosis. So we'll see how that works, and with the Cymbalta and stuff, and if it continues to get better, fingers crossed it might. Again, I'm real sorry that this ended up being 4 videos. If you sat through all of them, congratulations, and thank you very much for taking the time to listen to them. If you have any questions at all for me, please feel free to ask them either in the comments or via messages, and I will be more than happy to provide answers. I'm not very shy anymore, so most likely I'll answer any question you ask. If it turns out to be a slightly too personal question, I'll just let you know, but I don't think that's going to happen, because I've put a lot of stuff on the internet with people I've talked to, and most of it I just don't see any reason to be embarrassed. It's not that I asked to be in chronic pain. I did not ask for these injuries. I did not do them to myself on purpose, so I have nothing to be embarrassed about. And the way being in constant pain affects my life, I do have guilt issues, and sometimes I am embarrassed, but for the most part, not anymore. Again, it's not my fault. I didn't ask for this. I don't think anybody in their right mind would ask for this, because it is nothing but slow torture. And it's just horrendous to be in constant pain all day long. And as a mother, there's massive, massive amounts of guilt. It's just really hard. But I hope by making these videos that I can reach other chronic pain sufferers, especially those with back issues or pelvic issues, and maybe help them to know that they're not alone, that there are other people out there that understand. There are so many similarities between people with chronic illnesses and people with chronic pain, as far as reactions, the depression, the anxiety, the constant doctors, the medications, the side effects, insomnia, you name it. There's a lot of similarities. The causes might be different, but the effects, the final effects, are quite similar. Well, I'm going to go ahead and try to put together a video on pain journals, and then one on my pain scale that I use. I'll try to get them done today, since I've got nothing else to do, and it's raining here, so I'm stuck in bed. Otherwise, they'll show up in a couple of days. Thanks, everybody, and I'll talk to you all later. Bye.